Inspected it. It's within date. There's no issues with it. I'm going to pull this out. And as I pull this out, I need to make sure that I do not touch the actual swab to anything. I wouldn't want to be talking over it or coughing or any of that kind of stuff. I need to make sure that the swab is clean, dry, and intact and that there are no issues. Whenever I go through and swab, I need to swab on the wound interior since this is an open wound. And when you swab, you go from the top and you twist and go down the wound. And so I'm going to obtain the specimen now. So before I obtain the specimen, I'm going to actually take the lid off, making sure that I do not contaminate the interior of it. I will not need the cap again because once I put the swab in, this becomes the cap. So as you obtain the swab, again, you want it from a clean area of the wound with no old secretions, thus the reason we irrigated the wound before we obtained this. When I go in, I do not touch any of the wound margins around this. So I'm going to insert it, and you'll see how I kind of swab and I twist as I go down the wound. Once I have come out, the swab now goes down inside the container, and it will actually seal. You would then want to put patient identifiers on this swab. So most likely the patient sticker that has their name and date of birth and their medical record number. You would also put the date, time, and initials of when you obtained it. And you need to put the site from where the actual wound culture was obtained. So for her it would be midline abdominal incision. I have now obtained my wound culture. At this point, I'm going to set it off to the side on the table so that I can send it off when we're all done because I don't want to leave my patient. I want to make sure and take care of my patient at this point. So at this point, we've now obtained the wound culture after having done the wound irrigation. We're now to the point where we want to put the saline moistened dressing on the patient. So the first thing I need to do, make sure I've got on clean, dry gloves. Miss Smith, I'm going to remove the pillow from behind you. I'm going to go ahead and take that out. And then I'm going to lay her back over on her back. At this point, if she had wet dressings and things underneath here, I would want to go ahead and get rid of the old chuck, and I would want to come put clean, dry chucks and things underneath her, because whenever I put the dressing on her, it's going to be a saline moistened dressing, and it could actually cause some exposure. So at this point, I'm actually going to get rid of the old equipment, and I'm going to set up a new sterile field. And on this sterile field, I probably would use a dressing tray kit, and I would make sure that I have liquids and irrigation and that kind of stuff. At this point, I'm now taking off my gloves, and I'm going to go ahead and foam my hands again. We have gone through and we've irrigated Mrs. Smith's wound. We've obtained the wound culture. I have laid her back over on her back and removed any of the wet pads or any of that kind of stuff that was underneath her. So I need to go ahead and make sure and explain to her at this point that the rest of the procedure we're going to do is actually put a saline moistened dressing on her as ordered by the doctor. So the first thing I'm going to go ahead and do, if I needed clean gloves at this point, I could put those on if I was worried about contamination. I would go ahead and put the pad underneath her. You could put the whole thing underneath her, which would probably be a good thing to do. She'd have to hold her hips up or whatever. Make sure you're providing for privacy and keeping her covered here. If you had put on gloves for this, you'd want to go ahead and take them off and again foam. As we're doing this procedure, this is sterile, so we're going to go ahead and again set up another whole sterile dressing change tray. We need to make sure we've got some liquid over here because it is going to be a saline soaked dressing. If I need to move my table, I could do that at this point. The trash can is close by just in case if I need it. I've certainly got the red bag still if I need that for anything as I'm going through and doing this. As I'm preparing, make sure you always look at your equipment and everything that you need before you get started. So at this point, I'm definitely going to need a dressing change tray. I need to make sure that it is clean, dry, and intact, that it's within the expiration date. As I'm packing the wound, I probably would need some sterile cotton tip applicators or Q-tips. I'm going to need the saline to soak the gauze. Again, if this has already been opened and this is the same liquid that I had just used to irrigate her wound, I would need to date, time, and initial it before I left the room. Again, it is intact and it's within the expiration date. And then if I needed extra gauze or any of those kind of things that I needed at this point. So at this point, I think I'm ready to go ahead and open up my tray. I'm going to go ahead and peel this back. And then there is a sterile field in here. So I'm going to go ahead and again, like we had done before, I'm going to remove the sterile field by the corner. If it had an actual shiny backing, then the shiny backing would need to go down. As I'm doing this, I don't want to go to shake it. I don't want it to fall off of the table. I'm going to lay it down and hopefully not contaminate it. You can maneuver it from the corners. Please remember, anything that falls over the table, then you have 1 inch from that margin. I wouldn't be talking over it. I wouldn't be coughing over it, turning my back over it. At this point, I can actually come. I'm going to remove my sterile gloves from here. I'm going to bring this tray off to the side. And I'm going to come and dump the rest of the contents onto the tray. So as soon as I do that, I'm going to dump it and then very quickly back away. Without contaminating this tray, I'm going to set it back to the side, because now what I need to do is come and add the actual saline so that I can soak the gauze to pack the wound of my patient. At this point, I'm going to take the lid off, setting the cap down. The label goes in my hand. I would need to lip the liquid into the trash can, and I could come and I could add my liquid from 4 to 6 inches to my tray. Once the liquid is added, I come back and put the cap back on. I'm not over my field as I'm doing this. I'm going to reach back around, and I need to see if there's any other equipment that I need. Now during this, I'm probably going to need some Q-tips so that I can actually pack the wound. So again, clean, dry, and intact within the expiration date. I'm going to peel this down, and I'm going to come in and add it to my field. And that one fell on the floor, so of course we couldn't use it. This happens in real life. I'm going to open this up, and I'm going to add it to the field, and I'm going to let it fall. Now, if you need more than one, you can certainly do that. Sometimes things will fall into the floor. If they do, you just know that you can't use them. At this point, if I needed more gauze, I could add that at this point too, and I'm now ready to put my gloves on. Now, I no longer have any other space to put them on, but as we did before, there's a little bit of space here on the side of the bed with Mrs. Smith. She is alert and oriented. She knows what I'm doing. If I needed another table, I could do that, but I need to make sure that I'm not turning my back on my field as I'm doing this as well. I'm going to go ahead, and I'm going to come and put my gloves on. I'm going to open this up. Again, I'm going to come to the inside of the cuff. I'm going to step back. The fingers are down, and I'm going to put on the first glove. Please remember that if your hands are sticky or sweaty, if you're nervous, sometimes it can make them a little bit harder to get on. Now, keeping my hand above my waist, I'm coming underneath the cuff of the glove. Again, step back, the fingers are down. I'm going to come and put this glove on. Once I let go, I can now adjust my fingers. Again, my fingers and my hands must always stay above my waist. My table is above my waist anytime I'm doing the maneuvering. If your hands go below your waist, then you're potentially contaminated. I can now come and manipulate the items on my field. So I'm going to make sure that I've got the items that I would have checked that I needed before. I'm going to have some saline in the container. I've got to have some gauze that I can actually soak it in there to place it in. I need the Q-tip to actually put it in there. I could use the forceps, but I find that in a wound of this size, sometimes the forceps end up injuring the wound bed, and they're a little bit harder to manipulate. I do not need the iodine. I do not need the scissors. I do not need the pen. So anything that I don't really need, I can move it out of the way if I feel comfortable with it, but you don't want to do too much manipulation before you get started. The next point, I'm going to go ahead and take some gauze. I'm going to come over, and if it's got fibers, I really don't want to pack this in the wound, so I'm going to get a new piece, and I'm going to come, and I'm going to soak it in the saline. But when I pull it out, I'm going to squeeze out a little bit of it because it needs to be saline moistened, but it shouldn't be dripping over my field. You'll note that I've now got my sterile Q-tip here. I'm going to take the gauze and get it in my hand. And when I go to pack this, I need to make sure that I try not to introduce anything from the wound margin down inside the wound. So as I'm doing this, I'm going to take it and leave enough out so that I can pack it. And I'm going to then pack the wound. And you'll see the Q-tip, and it actually comes in and packs. And it would be better if we kind of started up at the top, and we'll try to move the gauze there. I want to pack the wound too firmly because you can actually expand the margins of the wound and it can impair healing instead of assist with it. At this point, my Q-tip did not touch anything, but I'm going to go ahead and move it over here and not put it back on my field. I'm going to get me another gauze. I'm going to come and I'm going to put it in my saline and squeeze it out. Again, not coming over my field. And I'm going to come back and I'm going to repack the wound again. And as I'm doing this, you'll notice that I'm using the Q-tip to actually push the gauze down into the wound. I'm trying not to introduce anything from the wound margin down into the wound, and sometimes it's a little bit hard not to do that. I'm not going to pack it too much because, again, you don't want to expand the margins of the wound. Once I'm done with that, I can now get rid of the Q-tip in the receptacle, and I'm going to come back and put some of the gauze over the top of the actual wound. And then I'm going to come back and I'm going to grab my abdominal pad and make sure the blue line is down through the middle. And I'm going to put this here. And now I'm actually done with the sterile part of the procedure, so I can actually move her gown out of the way to help me prepare. I could have already pulled my tape, or I could pull the tape at this point. But if I'm going to do that, I'm going to need to take my gloves off. And so anytime you're removing sterile gloves, make sure you grab in the palm of the hand, pull down, come underneath the glove, and pull down. I'm going to throw the gloves away, and I'm going to come back, and I'm going to foam again. Now, I'm to the point that I can go ahead and pull the tape, and please remember, depending on if the doctor says specifically in the order about the taping, if not, follow facility policy. You can always tape around all 4 of the edges. You can tape 1, 2, and 3. The tape, however, should not come more than about an inch off of the edge of the dressing because you don't want to irritate the patient's skin. Again, I would have needed to have asked her about her allergies and made sure she was not allergic to tape, especially silk tape. Since I have not pulled this at this point, I can go ahead and put this on her after I've pulled it. It doesn't hurt to sit the tape on the field now because I'm done with the sterile field, certainly. So I'm going to go ahead and pull another piece here and put it on the side. If you did actually come down and put some tape in this area, please be careful because you do not want to come down and put it into the patient's hair. That could be very uncomfortable. So sometimes I'll put a small piece of tape right here and so it stops right above the edge of the hair. The last thing I would need to do is pull off a smaller piece of tape and date, time, and initial it and put it down here at the edge of the wound, making sure I do not occlude where I would see the drainage or any of that kind of stuff as I'm assessing the wound. At this point, I have now completed removing the old dressing off of Mrs. Smith. I've assessed the wound for the length, the width, the depth, also the color, odor, consistency, and amount of the drainage. We have irrigated Mrs. Smith's wound. We've also obtained a wound culture, and then I've gone back through and I've applied a saline moistened gauze. It is date, time, and initialed. I'm going to assess her tolerance. Mrs. Smith, how are you doing? She says she's okay. I ask her, does she need any pain medication? She says that she feels all right and she doesn't need anything for now. Certainly I could have pre-medicated her, and then if she needs anything after the procedure. I'm going to go ahead and cover her back up at this point after I have removed any old chucks or anything wet. And if it was wet, of course, I would have gloves and things on. I'm going to cover her back up, provide for her privacy. I would put on clean gloves and remove any of the dirty equipment. Move that off to the side. I would assist her back in appropriate position for her and, of course, pull back up any rails. I need to lower the level of the bed. And I need to ask her what position she would like to be in. And she says she's like her head up a little bit. And now that I'm done with the wound care, I can actually do that. So I have assessed for pain. I've assisted her to a position of comfort. I would put all of her things back in proximity. I would make sure she has her call bell. Once I've cleaned my table, I would put the table back over here for her. And I would ask her if she needs to go to the bathroom. So I've assessed the 4 Ps. I also need to assess for safety. So I need to make sure that the bed is locked and that it's low. She has her call bell and there are no other safety issues. I'm now going to finish up aided and thank Mrs. Smith for allowing me to care for her today and for changing her wound. Ask her if she has any questions, and if there was any patient teaching that needed to be done, I could do that at this point. Certainly, I probably would have done some teaching before we got started. If there were any assessments that I needed to do in regards to her abdomen, I most likely would have done that when I came around for my shift assessment, but I could perform those now if I had not done that. There's nothing else that I need to do, so I thank her again, and we're done. Thank you very much.